guys, my name is Megan Dean. I am 19 years old, and the reason I'm making this video today is because I had Ameloblastoma, and I'm kind of just trying to spread the awareness, or maybe share my story, maybe help other people going along the same kind of road. Maybe you know someone who was just diagnosed, or maybe you're diagnosed yourself and you're just kind of looking for a little bit of answers. So I'm here hoping this video is gonna help. First of all, this is my first YouTube video. I'm clearly new to YouTube, and talking like this is all new to me, so please bear with me. I'm trying my best. I'm gonna just jump right in to this. It's kind of a long story, so I'm gonna just go over everything that I've been through the past couple months and start from the beginning. I was diagnosed with Ameloblastoma on April 11th, 2019. What Ameloblastoma is, for those of you who don't know, or maybe you're still unsure, is basically just a tumor of the jawbone. It can grow, anywhere along your jawbone. Mine happened to be right here. It's mandibular, I believe, is what they would call it. It was about an inch, a couple millimeters, maybe a little bigger. It was right about here. Maybe, no, it was probably a little bigger. It was probably like that. But how we found it, I've had a lot of people ask me, like, well, how did you know that you had this? Or why didn't you find it earlier or something? To be honest, I didn't know I had this. I didn't know. I think it's about a year and a half ago, maybe 2 years. I'd felt a bump down here, just along my gums, and it didn't hurt, didn't bother me, and I kind of just left it. And I'd gone to the dentist, and I had asked him, and I think he said, sometimes that's just how the bone is, or sometimes our gums are just like that and kind of harder in different places. And so I didn't think much of it. I was like, okay, it's probably just nothing, and I guess I've always had it, and I just never really paid attention until up until a couple weeks ago. I was fine, and then out of nowhere I started getting this pressure down here along my face, and I was like, okay, that's kind of weird. And a couple of days had passed, and it wasn't going away, and it was starting to get worse day by day, and I was getting a little concerned. I was like, okay, well, maybe maybe it's a cyst or something, and maybe I should go get it looked at just to make sure, because I was scared and I didn't really want to go get it looked at, but I figured I probably should. And so, funny story, my best friend's dad is actually a dentist, so I texted him and I said, hey, can you get something in my mouth and just tell me if this looks normal, or if it's something I should be concerned about or whatever. And he's like, yeah, come on over. He lives a street over, so I just drove over to his house, and he had his gloves, and he looked at it, and he actually was he had a hard time finding it. I knew where it was, I could feel it when I was in my mouth, but he said it was kind of in a weird spot, and he didn't think it was a cyst because it was so hard. And so I was like maybe it's just nothing, maybe I'm just kind of freaking out about it. I've had a lot of bad experiences, so I kind of just, I don't bring it up unless it's actually it's really bothering me. But I told him that it was really hurting, and so he said, come down to my office tomorrow and we can do an x-ray and we can just see if it's anything. And so I was like, okay, that works. So the next day I went to his office and we did an x-ray, and this was really weird. I'll actually put some of my x-ray, the pictures, maybe at the end of the video. I'm not quite sure. I'm new to this, so I don't really know how to put them in right now, but I'll just attach them at the end, or maybe down in the comments if I could do that. Basically, he was working on another patient at the time, and I had like his assistant, you know, the dental hygienist, she was the one doing it, and she did the x-ray, and she saw it, and I was looking at her, and she was like, I could tell she was really concerned, and I was asking her what it was, and she said she didn't know. She'd never seen this, and she was like, Richard, like, you need to come look at this. And he was like 1 second, and she was like, no, Richard, you need to come look at this. So he came over and sat me down, and he said, okay, we're gonna need a better x-ray. We're gonna need to do a panoramic. And so the panoramic ones that go around your head, you know. So we walked over and we did one of those, and he said, you know, like, at this point, like, I'm not gonna be the one that's gonna fix this. Like, it's out of my hand, and you're gonna have to go talk to an oral surgeon. So he actually had a oral surgeon working in the same building as him, and he loved the guy. He said, you know, I recommend him to any one of my patients. So we set up an appointment, and I went in, and, you know, he basically just sat me down and jumped right into it with me. He just said, like, you know, I'm 95% sure that this is Ameloblastoma. It is very rare. I mean, it's most common tumor in the mouth, but it's still pretty rare, and they don't see a whole ton of them. You know, a lot of doctors will go like their whole career dentists, and they won't see them or won't see anything kind of like them. So he had actually done the surgery before he'd seen it, so he kind of knew exactly what it was. But he said that they would have to do a biopsy before we did anything further, just to kind of know, to get to that 100% like sure, like, this is what this is. But, you know, he was kind of preparing me, like, you know, like, pretty certain that this is Ameloblastoma. And so, you know, he kind of started going over the procedures with me, and I was just like, you know, my heart just sunk. Like, I was like, what? Like, I thought it was a cyst. Like, I wasn't gonna say anything. And, you know, just to go in and to hear, you know, I have a tumor growing in my bone, and I'm gonna have to get it cut out, like, kind of just put me in a shock almost. I was doing my best just to process it. So he started going over the surgery options with me, like the ups and downs. This is kind of why I'm making this video, is because of the way that I chose to have my surgery. A lot of people normally do what is called the free flap, I believe, where they take the bone graft out of either your hip or your leg, and some stem cells, and they reconstruct it and put it into, you know, the area that they need to on the jawbone. That was an option for me. I really didn't want to, because I mean, that's one more thing that they're gonna have to cut open, and more pain kind of thing that I didn't really want to have to go through. I mean, I would have if it was my only option, but he told me about this other one, and I wrote it down because it's kind of long. It basically is just a mandibular reconstruction with a cadaver bone. He also did a trinity bone. I think that's what it was. It's kind of like a mix. So he got a cadaver bone and basically blended it up and got this trinity bone and mixed it in with it, just to kind of make it grow back faster, kind of heal faster, and just like start pulling all the blood cells and everything to it, to just help it heal and do everything as quick as we could. That was the second option. The third option was actually to go to the Huntsman Cancer Institute and to have those doctors do the surgery. And the only thing I didn't like about that was that those doctors that do the operations, you know, what they do is they remove cancer. You know, they take out areas and they reconstruct them. But obviously the mouth is a little bit different than reconstructing something else, and it has a lot of different curves, and like, you know, with it being such a big part of my face, it's such a large portion, I was a little more picky, you know. I kind of wanted it to be something that I would be like, okay, like I know that my face is gonna be okay after this, and you know, my teeth will be able to get taken care of. Like nothing against that route at all. I just, like, personally, I preferred the second option, the cadaver bone. Another thing with this option is there's a little bit higher risk of infection, just because we're going to be coming in from the bottom and also in the mouth, and the mouth is just such a dirty place. And so, you know, if it gets infected, or this cut down here gets infected, like it could possibly like just ruin this whole bone and like everything, and we'd have to go back in and do a new surgery, new bone, like new completely everything. And that was a little bit higher with this one, just because I'm not quite sure. I wonder if it's just because it's cadaver bone, but you know, he said that he thought we would be fine, and we're to the point now. I'm 4 weeks post-op, so a little over 4 weeks. So my face is a little still swollen, but I mean, this side is pretty much fine. It's just a little bit down here that's still swollen. So I went in for my biopsy the following week, I believe, and they just cut out basically a little piece of it and sent it to the lab just to make sure, you know, it wasn't cancerous or anything. And the results came back, and it wasn't. It's a benign tumor, which is what most of them are. And so we were able to move forward with planning surgery and getting dates ready and picked out, and you know, kind of moving on with that. So I don't know really how to there's so much. So I had so many x-rays done, but they actually had me go do another big panoramic one. And what they were doing, it was they were going to take a 3D image, like 3D print an exact copy of my right side of my face to reconstruct my left side, because I would have all of this taken out, and they wanted, you know, it to look as normal as they could make it. So what they did, they actually just used my x-ray, and they just sent it to this company in Germany, and they reconstructed they created a titanium plate. We actually had 3 separate plates, so I have one plate right here, one up here, and then one down below the crib. And he did that just to give the plate like a little more room to move, just because I have so many muscles, like your tongue muscles and everything down here. He didn't want it to like crack it or like move it or break it, you know. So he had to do a couple different changes and stuff, but you know, overall, my surgeon has been amazing. Like, he was so organized and so quick to tell me what was going on, and made me feel so comfortable, and like felt like I knew what was happening and the next steps, and that he was so certain. And it just really helped, because I've heard a lot of stories like of people that doctors just haven't kind of kept them in the loop, and they're just super scared, and they don't know like if they know exactly what they're doing. And like I never felt that once, I don't think. We had a lot of communication, and he was just so organized, so I knew he was the right guy to be with. So anyways, they had that plate made. It took about 10 days, I think, and then they had to ship it here, so it took like 2 more weeks. And my surgery date was May 8th. So that's 4.5 weeks from now. That surgery was about 7 hours. They removed about 2/3 of my jawbone, maybe 3/4. I'm gonna show you guys my teeth and my face. So I had nothing over here. They took out 9 teeth. I have 5 left, 5 over here, which I'm so glad it wasn't any bigger than it was because it's already so hard to eat with just 5 teeth. And so they did that, and then also this is my scar. Sorry, this lighting is so bad, but that is what it looks like. Yeah, you can tell I'm still a little swollen over here. And they had to attach the plate up here so they cut like right here, and like right here is where they cut. And then they had to attach the titanium plate over here and then up here. So I think they just screwed it in. There was like 15 like little bolts they had to put in. And yeah, so my surgery was about 7 hours. I woke up, I remember they were rolling me back to my room and I was super confused. I mean, I feel like this whole journey had just like gone by so fast, like it's just moved so quick, and like I didn't have the whole ton of time to process exactly what was going on. I just knew that, you know, I had this tumor and it wasn't cancer, it was benign, but it was growing, and it was growing pretty rapidly, and you know, I didn't have to have it taken out, but obviously it would keep growing if I didn't, and I didn't want, you know, those people that end up their face is super deformed, or you know, it moves your teeth. It was moving my teeth. So that would be what would happen if I left it. So I obviously didn't want to do that. Anyway, so I woke up in the hospital after the 7-hour surgery, and I had tubes, like draining tubes, just to help the blood flow, just to drain it so it was gonna get swollen, but the Trinity bone that he put in basically just drew stem cells to my face just to help it heal better, help heal faster. And so like it wasn't swollen, but it's like gonna be like extra swollen just because of the help of all the other stem cells. So I'll put those pictures up at the end as well. It's just like my face was huge. My whole face was just swollen, and my neck. That I think out of this whole thing, that was probably the worst part about it, was just how tight my face felt. Like I couldn't even like move my neck. Like I just had to lay straight, and it just like was so painful. I think the peak of my swelling was like day 3 or 4. I kind of wish that I had made videos throughout this, but like I said, like I didn't have a whole lot of time to process everything, and I wasn't necessarily worried about documenting everything because I was just trying to get through it. So I guess that's why I'm making this video now, is to just kind of tell everyone my story. And I think I was on solid foods for probably the first 2 weeks. I didn't have my mouth chained. He said it wasn't necessary because we didn't have any moving pieces. Everything was bolted in, and it was just this isolated bone. It wasn't like multiple pieces or anything. You know, the plates were already drilled in, they weren't going anywhere. So I was actually able to have my mouth unchained, which is awesome because some of the stories and things I hear about that look terrible, and I would have died if I had to do that. So I was able to eat some liquid food. It was kind of hard, and I actually just had those little like ketchup bottles, the little squeezy ones, and I had just had my mom make me soup, and I just drank them, and lots of smoothies, lots of ice cream. I had lots of Oreo milkshakes. So that was how I lived. And then after the first couple weeks, the swelling inside was kind of going down. I actually couldn't close my mouth all the way because it was so high in the back, and my teeth were hitting before these teeth were, so I couldn't even close my mouth, and I just couldn't eat. It just hurt so bad, and I just had I had stitches all over, you know. I didn't really want to eat. I didn't have much of an appetite, so I was just drinking my calories and trying my best to get protein and stuff in me. I think probably like week 3, maybe closer to 4, I was moving on to soft foods. Just because it was getting easier to move. He had to cut. So my tumor was actually growing through both sides of my jawbone. So it was growing through on the outer side and it was growing through on the inner side. So he actually had to cut kind of underneath my tongue and just like reattach everything down there. And my tongue, I could not move it like for the first couple weeks. Like it didn't go anywhere and it hurt so bad, and it was just getting like, it got so tired and I didn't want to rip anything open because I had a very large incision in there. They actually wouldn't let me leave the hospital though until I could get like a little icy thing down, and it was so hard to like use my tongue to get it down, but I wanted to go home. I had to try so hard. And then my doctor basically just told me like I was fine and you can do it, and I did it and was able to go home. But that was really hard at first, and even now, like talking or like eating, my face, like my mouth gets super sore. Like not super sore, but I mean it gets more now. Like if I'm a part-time receptionist, so like talking on the phone like kills me. Like if I'm doing it for like 10 hours a day, or like I started out slow. I came back and only worked a couple days a week, or a couple hours a day, and then a couple of days a week, and kind of just eased on into it. I think altogether I took about 3 to 4 weeks off of work. My doctor told me 2 to 3, but I was just like, I would get up and I think I'd be fine, and then I would feel crappy again. And so my work was like so awesome with me, and they're just like, like stay home and rest until you can do it, don't push it. And so I was lucky I got that extra rest. I'm still at home and I didn't have to, obviously I didn't get money for that long, but I wasn't, dying or anything, so that was really awesome. Anyways, I'm gonna drop my email, just, sorry. I use that, it's like still pretty hard to talk, and since I don't have any teeth, like I had a really bad lisp, and I still have a little bit, but I'm working on it. And then I'm getting actually a retainer in the next 2 or 3 weeks. I had implants done, and I am seeing a prosthodontist. He's actually the only one in Utah, and he is so awesome, and he is making basically just a retainer with these front couple teeth on it for me, just to talk to people, like when I'm talking or when I'm trying to smile. Like I don't really have like my lip doesn't really go anywhere when I'm talking. I don't have any filling down there. I forgot to mention that you have a nerve that runs through right here on your face, and before the surgery I was actually losing filling down here. My gosh. I was actually losing filling down here, and he had mentioned like he was going to have to cut the nerve and pull it through the tumor and try to save it. But I guess when he was in the surgery, he said it was too damaged, it was shredded, and he couldn't save it. So he actually did a nerve graft as well. So he just reattached it over here and down here. So I actually don't have any filling like anywhere over here. It's slowly starting to come back on my lips, which is awesome. It just feels a little tingly. But nerves take a really long time to grow, so it is pretty weird. I mean, I'm getting used to it, but like people, like I could just like have something brushed up against me and I have no idea. Like when I'm eating, especially, like my boyfriend or my family has to tell me like, hey, like you have food on your face, and I'm like, oh, I didn't know. So that's a little weird, but hopefully when I get those teeth, it'll help my lips stay down a little bit and help my speech, because I do struggle sometimes. But I'm gonna get my real implants in about 6 months, 6 to 8 months, but we're shooting for 6 months. What they're gonna do is they're gonna just go in and drill holes, basically, and then attach the implant piece. So it takes about 6 months just for this bone. It has to harden and kind of grow in and reattach. So, and that's what we're waiting on right now. It's still a little soft. I had to massage my gums a lot after my surgery just to get the swelling and like the bone to go down and where it needs to be, kind of a thing. But once everything gets all hardened and strong again, I can get my teeth, and I'm so excited. I might make another video then just to kind of update everyone. I don't really know. I've had a lot of people reach out to my mom. She has a Facebook, I don't, and she's kind of sharing the story, and she's had a lot of people from other countries or, other places around the world, and they are going through the same thing, and they want to know, like, hey, like, what surgery options did you do? How was it? Like, what do we do? We don't know what to do, what my options are. And I just want to let you guys know, like, I am totally open to, emails. If you want to look me up on Instagram, like I said, I don't have Facebook, but I do have an Instagram, Twitter, whatever. I'll probably put my email at the end or in the comments, and you guys, like, feel free to email me, ask me any questions. Maybe you're going through the same thing and you need a friend, you need someone to, like, give you advice and talk you through it. Like, I wish that I had that when I was going through this. And it would be nice to meet other people and, know that I'm not the only one that had to do this, because I am 19. It's pretty young to have to go through such a crazy thing, but we are on the way up, and I am glad I did it. Glad we did the surgery and got it all done, and it was not as bad as I thought it was gonna be. So it still sucked, but we made the best of it. So if you guys are looking to talk or have any questions, feel free to reach out to me. Anyway, I think that is all. So thanks for watching. I appreciate you guys. Hey.